included in the law, and it's often referred to as the Affordable Care Act. So if you hear that, that is the law that was passed in March. And it does reflect some of the common value statements. Let's see here. There we go. That we've heard from Kentuckians across the state and across the Commonwealth. These common values are peace of mind, affordability, fairness, choice, and control. Kentuckians want to know that their family will always have good health care and that they can afford that good health care coverage. They want the current coverage and they want to keep their own doctors. They want to see the doctor when they want the doctor to be available to them, and they do not want insurance companies making decisions for them. And they also want doctors and other providers to have the time, access to information, and support needed to give the best quality care. So looking at these value statements, the new health care reform law gives hardworking families peace of mind. Who will get help right away? Seniors, small businesses, people with chronic conditions, children with pre-existing conditions, and young adults without insurance. Many of these constituencies are already seeing help this summer. For pre-existing conditions, the healthcare reform law, the Affordable Care Act, stops denials of coverage and eliminates higher premiums based on health status and gender. They have created a new pre-existing condition insurance plan, the PCIP. It was unveiled in July, and this is going to be a high-risk pool for those who do not have insurance, who have not been covered in the last 6 months and have they've been denied health care coverage because of a chronic condition. They now have access to an insurance plan for them. The Affordable Care Act also seeks to provide a consumer-friendly insurance marketplace. They're trying to standardize the plans, promote competition, and you yourself will have coverage just like members of Congress. The Affordable Care Act seeks to impose insurance company accountability. They want to focus on the spending of health care, not on the profits. And they want to make sure that the premiums that are being paid, that the money is going to providing health care and not to administrative costs. It also seeks to give refunds to consumers if requirements are not met. And the Affordable Care Act provides stable coverage, offering coverage choices for all, regardless of places of work, and creating a safety net for job loss. And this is critical in a time where our economy is facing much more unemployment and individuals without employee health care coverage. The Affordable Care Act seeks to reduce out-of-pocket costs through capping out-of-pocket costs and through extending help to lower and middle-income people. And it seeks to prevent loss of coverage, to stop unfair rescissions of coverage, which is the cancellation of contracts, and to require evidence of fraud or intentional misrepresentation in rescission cases. You may have heard in the media recently the help for small businesses. There are tax credits for small businesses included in the Affordable Care Act to help make it more affordable for small businesses to provide their employees coverage. And that they also seek to increase the buying power for these small businesses that currently have not been able to do so because health insurance has been too expensive for employers to cover their employees. And there's also help for young adults. You've probably already read in the news that the Affordable Health Care Act allows coverage through Parents Plan until the age of 26, and it offers stable coverage for recent graduates. The Affordable Care Act provides help for families. It expands Medicaid to millions of Americans. It provides help for those affected by the recession, and it offers to help also middle-income families by providing tax credits to buy insurance. And as our host, AARP, can attest, it also gives improvements to Medicare by eliminating the donut hole. In July, there were checks that started going out to seniors who were affected by the donut hole. This is the area, a coverage gap in your prescription drug plans. It also seeks to provide free preventative care with screenings, certain screenings being covered without copay, and it tries to extend the life of the trust fund. The Affordable Care Act also seeks to assist with long-term services by helping states expand home and community-based services. And it extends financial protection to spouses. It also establishes the Community Living Assistance Services and Support Program, which helps to keep individuals in their own home, providing the care in the home instead of in the nursing home. And preventative care is a main focus. It calls for innovations in preventive care. It also would like to use health IT to improve information systems and start rewarding quality care. Currently, we have sort of a sick care system, and our healthcare system is driven by those with illnesses and when you have chronic conditions. And we would like to see this system to be a healthcare system that focuses on wellness and preventing some of the increased cost that come with chronic conditions. There are quite a bit of there's a number of Kentuckians who will benefit from the Affordable Care Act. 920,000 lives will be affected from the pre-existing health condition provisions in the law. 261,000 Kentuckians will be now eligible for Medicaid with the expansion of the 133% federal poverty level. And 221,000 are the number of families who will receive tax credits for health insurance. 51,000 small businesses will receive tax credits for employee health care. 129,000 Medicare beneficiaries will benefit from the rebate checks for the donut hole. 16,000 young adults who may be covered until the age of 26 will now be able to be on their parents' health insurance plans. And 63,000 will go to support, 63,000 lives will be benefited from the early retiree provisions. I'm now going to turn it over to Bob Gray, who will go over the timeline when a lot of these provisions will go into effect. There is a gradual timeline. Like I said, there were things that started happening already this year, and then there's going to be additional provisions that get implemented on September 23rd. And then 2014 is another big year where a lot of provisions will be implemented. So I'll let Bob go through our timeline. And we also have a timeline handout for you that you can take home with you and review.
I also wanted to mention a couple of things before I walk you through this timeline on this new law. We do have an information booklet that's available if anybody would like a copy of it. It has a lot of questions and answers in it about this new law, and it also has this information that we are presenting to you today. So if you're interested in a little bit more detail, you can just pick up one of these information brochures. It has a lot of information in it, and it can tell you where you can go to get more information and to answer your questions. The other thing I wanted to mention, since we're here at the State Fair, a friend of mine was asking me how this new law affects you if you eat too many donut burgers here at the State Fair. And we're going to check that out for you, but I really don't think it's going to do anything to you if you eat too many donut burgers. I may have to try one myself. But this new law will take effect gradually over the next 10 years. Everything doesn't happen at once, and we wanted to walk you through just a few of the key events that are going to happen from now until 2020. Jody's already mentioned some of this, but starting this year, there'll be already, once this law passed in March, there's immediate benefits available for folks. If you have a small business of 25 employees or less, you can qualify for a tax credit up to 35% of the cost of providing insurance. Your business is not required to provide insurance, and it won't be required to provide insurance, but if you do, you'll get an additional tax break for doing it. Jody also mentioned this high-risk pool. If you have some kind of health condition where you haven't been able to get insurance, you can sign up for this new program where you can get health coverage at the same cost as anybody else, so they will not charge you more money for this new coverage. And also, as Jody mentioned, now, if you have a child up to age 26 and you have health insurance, you can get them covered under your health plan. Your child doesn't even have to be living at home, and they don't have to be a full-time student. Until this law passed, your child had to be a full-time college student in order to get them in your family health insurance plan. So that's a new change that is going to affect now. And then if you're on Medicare and you're in the donut hole where the drug coverage kicks out for a while, you're going to get a check for $250 this year, and a lot of folks have already got those checks here in Kentucky. The next big time, the date on this law when changes are going to happen are next month, on September 23rd. There's some changes that are going to affect the way health insurance operates. And if you have a new health insurance plan starting on September 23rd, any kind of preventive service they have to cover without you having to pay any kind of additional copayment. So you get preventive checkups and those kind of things without any additional charge. And health insurers are also going to be prohibited from denying coverage to children who have some kind of health condition. They can't place a lifetime limit on your health coverage. And if you get sick, they can't drop your coverage. That's the rescission that Jody was talking about. Starting next year, if you're on Medicare, you're going to get discounts on name brand drugs. So if you get a prescription for a name brand drug under Medicare, you're going to get a discount on that you're not getting today. Your primary care doctor is going to get an increased payment too of 10% under Medicare to help give them an incentive to provide better preventive coverage. And starting next year, health insurers are going to have to pay 80% of your health premium on health services. It's what Jody talked about earlier. They can only spend 20 cents of every dollar on administration, and 80 cents has to go to providing care to you. In 2012, if I can get this to work, in 2012, there's going to be the opportunity for something called accountable care organizations to get additional payments through Medicare. These are organizations that would be a group of physicians, perhaps even a hospital, where it's a large organization where you can get a lot of care. And these are folks that can band together to provide these services. This is an incentive in this law to try to make these organizations come to pass. There's already a number of them around the country. They're seen to provide better care at a lower cost, so the idea is to give healthcare providers an incentive to do these kinds of programs. Medicare is going to start linking how much they pay a hospital or a doctor to the quality of the service they provide, and there's a number of measures in there that will start looking at the outcome, they call it, of care, so that when you pay a hospital or a doctor, if they do a better job, they'll get paid better. And another big change in the law, if you go to the hospital and get sick, if you get what's called a hospital-acquired infection, Medicare is not going to pay the hospital for that, and the hospital cannot charge you for it. So the idea is to get hospitals to have better controls, so they'll stamp out hospital-acquired infections because they cost a lot of money and obviously cause patients a lot of problems. In 2013, if you have a flexible spending account, you're going to be limited to being able to put $2,500 a year in it, and there's going to be limits on how much on your medical expenses and being able to deduct them from your taxable income. Right now, you have to have at least 7.5% of your income in medical expenses before you can deduct it. In 2013, it'll have to be 10% before you can deduct it, unless you're over 65, and you can still deduct 7.5% through 2016. In 2014, that's probably the most significant year under this new law. That's when the requirement goes into effect. It basically says every American has to have health insurance, or you're going to be penalized $695 or 2.5% of your income. If you're on Medicare, if you're on Medicaid, if you get insurance at your place of business, you're going to be covered and this penalty won't apply to you. If you can't afford coverage, Medicaid is going to be expanded to families that have almost $30,000 a year in income. So if you can't afford it, you'll be able to get coverage through the state Medicaid program. And the main requirement for employers, if an employer has more than 50 employees and they don't offer coverage, they will be assessed a penalty. That's not going to apply to small employers, though. Also in 2014, this is when health insurance, they can't base your health insurance rates on your health condition. So if you're sick, if you have a health condition, they can't charge you more money for that, and they can't deny you coverage, or they can't refuse to renew your coverage if you get sick. There's going to be these new health insurance exchanges, they're called. They're like supermarkets to buy health insurance, where you can go and buy health insurance. If you buy insurance through a broker or an insurance agent, you're still free to do that. But this is a new opportunity that's going to be available to buy coverage. And if you do buy coverage and don't get it at work, you're going to be able to qualify for tax credits to help pay for that. So there'll be help available for people to buy coverage that's not available today. So 2014 is a big year under this law. In the out years, 2016 through 2020, states are going to be allowed to get together to sell health insurance coverage. The idea is to let states get together with lots of people, maybe states like Kentucky and Indiana can get together to get people a better deal on buying coverage because of the large number of people that could involve. Again, that's an option. There's no requirement to buy coverage that way. And if you have very expensive health coverage, there's going to be a tax imposed on that, and that's if your coverage costs more than $10,200 a year if you're an individual. That amount will go up every year. As we've looked at it, there are very few people that would have a tax put on their health insurance. And then in 2020, if you're on Medicare, the donut hole where the coverage stops and starts for a while is going to be eliminated completely. So you'll have continuous coverage for drugs if you're on Medicare. So just in conclusion, as Jody's talked about, this law has provisions that makes health insurance and coverage more comprehensive, more affordable. Everybody will have it. There are provisions in it that try to control costs, improve quality, and create competition and give citizens more choice to buy health coverage. As I said, our booklet has a lot of questions and answers in it, but if you have any questions, Jody and I will try to respond to them right now. And thank you very much. Anybody have any questions? Thank you all so much.
Thank you for coming.